Is Ozempic the commonly prescribed and used diabetes drug not only helping you to lose weight, but unfortunately causing you to lose hair? In this video, we will cover exactly why this happens and the reasons it may happen, whether it's actually due to the drug itself or other contributing factors. We will talk about the important things to consider when undergoing any massive weight loss program or treatment, and we will talk about tips and tricks that you can consider to mitigate the loss of your hair using drugs like Ozempic or some of the alternatives. Now, in the early stages of trialing drugs like Ozempic, there was no known reports of a side effect like hair loss. However, those are obviously early trials, so it's not to say that now that their drug is used on a global basis, and as we know, people are using it not just for the indications of diabetes, but for weight loss and things like this. So it's not that the drug might not actually be causing hair loss. However, it's not something that was first described as a known side effect of the drug. What we do know is rapid weight loss due to any treatment modality or any program, exercise, diet program, or more intensive interventions like bariatric surgery, for instance. They are associated with quite a high number of people reporting losing their hair in the period after losing the weight. So why does this happen? The body basically goes, well, okay, we've got less resources now, and so with less resources, I'm going to have to start deprioritizing things. And what does it deprioritize? Well, it deprioritizes things like our hair. And so what the patient notices is a reduction in the volume of the hair or increased shedding. Now, what this is described as, or what this is called, is a telogen effluvium. And so what happens in this instance is your body shifts a large percentage of the hair that's on your head from the growing phase to the shedding phase. And so what happens in this instance is you can have up to 50% of the hairs on your head shifting from the growing phase to the shedding phase. So you think about 50% of the hair on your head now shedding would obviously be experienced as quite an alarming amount of hair falling out, which obviously puts a lot of fear and trepidation in patients experiencing this. However, it's not necessarily unique to taking drugs like Ozempic. This is something that is commonly experienced by people who do undergo things like massive or rapid weight loss programs because it causes stress to the body. Now, other things that can cause telogen effluvium, which put extreme stress on the body, things that we're well aware of, are things like high fevers, severe infections, major surgeries, acute physical traumas, chronic debilitating illnesses such as cancers, hormonal disruptions such as pregnancy or childbirth, and some medications like anticoagulants, beta blockers, retinoids, and immunizations. So as you get the idea of this is something which is not unique necessarily to a particular drug, even though some of them do have a higher incidence of causing it, but it's due to the stress caused on the body through the process of losing large amounts of weight in a short space of time. How long does this telogen effluvium or TE or shock loss last? Well, for most people, they start to experience this telogen effluvium or the shedding of their hair in the period of about 3 to 5 months after having experienced the stressful event or their body experiencing the stressful event. So it doesn't happen immediately. It usually happens about 3 to 5 months after the rapid weight loss or the stressful event is caused. Now, in terms of how long that takes to recover, this will, for the most part, spontaneously recover or recover by itself without any interventions within about a 6 to an 18-month window. Now, obviously, that's quite a large range, and it's quite difficult for patients who will be sitting there at 12 months still not seeing much of recovery. If it's just due to the stress caused on the body and there's no other underlying factors, then this will typically recover by itself within that 6 to 18 month window. However, in a small subgroup of people, this can lead to ongoing or chronic shedding due to shortening of the anagen phase of the hair growth cycle. This can also, in other people, unveil other hair loss related conditions like androgenic alopecia. So the massive loss of hair can then bring forward or expedite the process in which someone might actually start seeing signs of male or female pattern balding. Now, a general rule of thumb is, if it's just due to the massive weight loss itself over a short space of time, then the hair is likely to recover within that sort of 6-month period. However, if it's due to other reasons, which can also be experienced with weight loss, that we'll get into, like micronutrient deficiencies, then unless those are corrected or accounted for and remedied, then that can lead to ongoing shedding. In a well-known meta-analysis review, looking at 18 different studies that investigated hair loss after bariatric surgery, what was found is that up to 57% of patients experienced hair loss after bariatric surgery. What was also found is that it was more common for women to lose hair after bariatric surgery than men. Blood levels of zinc, iron, and folate seem to be lower in patients losing their hair after bariatric surgery. It's possible that the loss of subcutaneous or superficial fat on the scalp after going through bariatric surgery can be enough to then not support the hair, and so that can further contribute to the hair loss. Another contributing factor was found that low levels of protein in patients that undergo significant weight loss can be a contributing factor to hair loss. And then obviously the acute stresses of having had surgery. So having a huge stress to the body due to having surgery, and the stress, the anxiety of having surgery can also be a contributing factor with respect to hair loss. Another study that looked at hair, skin, and nail complications after bariatric surgery. Some of the key findings in this particular study were that patients that went into the surgery with micronutrient deficiencies were typically those that experienced more significant hair loss. And you can understand that if you're already in a position where, because of things like obesity, you have lower levels of micronutrients, you have things like vitamin D deficiencies potentially. If you're going into surgery with pre-existing deficiencies, then when you undergo rapid weight loss and you also have appetite suppression, the situation can then lead to you having a worsened picture, and which can then also contribute to the hair loss. Because again, it's the same thing. Your body wants to prioritize sending nutrients to the vital organs, for instance. Your hair, as much as it's important to us, is not necessarily the highest priority in your body in terms of favoring it and giving it all the nutrients. So it gets deprioritized, and that can lead to hair loss, as we know. Another thing that people can see as well with respect to when they're experiencing a telogen effluvium or hair loss within their nails, and this is discussed in this paper, is you can see something called Bow's lines, and that's where you get a horizontal line across your nails. Now, your nails from the base of the nail to the tip takes about 5 months for that to grow out. So you can basically track, or it's said that you can track how long ago the stressful event started based on where that line is on your nail. So if it's halfway up on the nail itself, well, it's considered that it would have been about 2.5 months ago that the stressful event occurred. Doesn't occur in everyone. That's a very interesting finding. What are the micronutrients that are important with respect to hair? And what are the micronutrients that, if there's deficiencies, can exacerbate hair loss in a rapid weight loss situation? So these are vitamins A, the B vitamins, B2, B6, B9, B5, vitamin C, vitamin D, vitamin E, vitamin K, biotin, as we're aware, copper, iron, selenium, zinc, and proteins. So obviously, as we can appreciate, nutrition can have a huge impact on the health of your hair, but also the health of your nails and your skin. So if you are taking a drug which is suppressing your appetite, as well as leading to significant weight loss, you then might be undernourished or malnourished. And so you're therefore not getting all the building blocks that your hair needs to thrive. This, combined with the fact that you have significant stress on the body during this time, well, this can be enough to lead to that telogen effluvium. This could be enough to lead to that significantly increased shedding of the hair. Okay, so what are some tips to be able to mitigate or reduce the hair loss risk when you're taking something like Ozempic? Well, first off, don't be tempted to self-dose. Human nature is we often want more of a good thing. So we feel like, if the doctor's prescribed us, to use this amount, if I use double that amount, I'm going to have double the weight loss. Well, it doesn't work like that. And what happens is you can put your body at risk of side effects and complications. So always be guided by your medical provider on using drugs like Ozempic. Another important note is don't be tempted to go and get things that are off the black market or off the internet that mimic these sorts of drugs. If they don't have the tick of approval from TGA, FDA, and they're not bought from a reputable provider or chemist, then the likelihood is you have no idea what's going into your body, and that's a scary place to be in. So don't take shortcuts in that instance. It's also really important to ensure that you have optimal intake of all those vital micronutrients that we discussed. And this could mean that you might need guidance from a professional. So heading into a rapid weight loss program or a weight loss program of any sort, it is important to check with your provider to see that you don't have pre-existing deficiencies, because then it would be really important to make sure that you monitor those over the weight loss time frame. So if you can check to see if these are already present before going into a weight loss program, you can better mitigate the effects of that and make sure that you optimize these levels whilst losing weight. And it might mean supplementation. And what are some treatments that you can look into that can help improve the speed in which you can gain that hair back or regrow that hair that's been shed out? There's a range of different treatments. It's obviously so important that you see your primary care physician first to get a diagnosis and look into some of the underlying causes like the micronutrient deficiencies as we're discussing. There's topical treatments that can help. So just application of topical treatments like minoxidil may be able to help you in this instance. There's other herbal extracts and stuff like this that might be able to be formulated to help you. And then there's mechanical treatments, so stimulating treatments like PRP, for instance, and microneedling. So there's a range of different treatments that will be able to help you. However, it's so important to be guided by your physician into which is likely going to have the highest probability of working for you. But there are things that you can do to help speed up that process of growing the hair back. Hope this helps. Hope you learned something. I hope it's provided some good food for thought. And as always, if you have any comments, if there's anything that you would like me to read up on, check out literature reviews, anything like that, just post it in the comments. Happy to answer questions. Cheers.